Patel, let's talk a little bit about gum disease, gingivitis, periodontal disease, kind of like all the same, at least I think, correct me if I'm wrong. It's just the stage, usually it's like the severity of it is a little different. And especially I want to talk to you about the real implications which the patient usually doesn't see. It's a silent illness, which doesn't do much except maybe a little bad breath, and even that he doesn't smell himself. So tell us a little bit about really how bad it is beyond the potential tooth loss which most doctors promote, and which is bad in itself. But frankly, you doctors, the dentistry in itself, you guys have gotten so good that losing a tooth, well, it's not anymore like in the George Washington time who had apparently a wooden tooth in it. You know, that must have been
no kidding.
An uncomfortable thing, right? But don't even know whether it's true. Is it true, by the way? I don't know. Is it true that he did?
From a historical standpoint, it is true, yes.
Okay, so let it be true. And so while this is bad, it can be fixed. But yet, while this is going on, there seems to be drastically more going on, and I would like you to shed some light on that, please.
Sure. Periodontal disease is basically a condition which affects your gum and bone around your teeth. Now, that being said, there are four main stages to periodontal disease. The first stage, which of course is gum disease, is in a medical literature known as gingivitis. The second stage is a mild version of periodontal disease. The third stage is a moderate version of periodontal disease. And the fourth stage is a severe version of periodontal disease. In stages 2, 3, and 4, you have not only inflammation or bleeding of the gums, but you also now have below the gums, which is a bone support around your teeth, the breakdown of this bony support. So in essence, over time, as the breakdown of your bony support occurs, you're physically losing the foundation of your teeth. Henceforth, in the more severe stages, you have loose teeth, which eventually would need to come out. Periodontal disease is a very, very overlooked and misdiagnosed condition in many dental offices across the country. But as you mentioned, you know, the newer generational dentists are putting more stress and emphasis coming out of schools and taking these higher education courses in correcting the disease itself. Is the disease correctable? Absolutely it is. Because if uncorrected, there have been many systemic links to periodontal disease, which you know, is never a good thing when it's linked to cardiovascular disease, which is your heart, diabetes, respiratory disease, osteoporosis, low birth weight, pregnancy issues, and the list just goes on and on. So there's many relations to this undiagnosed disease, and here at Alpha Dental Excellence, we take it very seriously to make sure that, look, before the teeth are treated, the environment in which your teeth sit in must be healthy before you go ahead and expect a healthy, you know, tooth issues.
Right. So if you don't mind, could you, for just, you know, as short as possible, a little bit explain why this periodontal disease, which I think can be described as bleeding gums. Little bleeding gums is maybe the gingivitis part, the first stage. More of it is probably more. So a bleeding gum is obviously an infection. It's kind of like that if you cut yourself and it gets infected your finger and you get that yellow reddish pus. That is basically a gum disease infection. Am I correct there or not?
No, you're absolutely correct. What happens is, you know, it's not the bacteria that physically causes the gums to bleed directly or the bone to break down. What essentially happens is when patients do not clean below their gum, and one of the best methods is by using a dental floss and mouthwash in combination, bacteria hangs around below the gum. it attaches to your tooth structure. Now your body recognizes this, and our body's natural defense system is, let's just go ahead and send as much blood supply to the area so that we can battle with this bacteria and remove it. In doing so, this battle is what causes the bone breakdown. So it's, and because there's a battle going on and there's extra blood being sent to the area, that's where the bleeding gums come in play as well. So, you know, the best practice of method, or the method of practice there would be to not have bacteria. That way your body's not battling, you know, anything below you.
Okay, so let me again see whether I'm getting this right from what you're saying, or whether I can. So there is this infection there, and it comes, you know, somehow the body goes, something isn't right there, and it sends soldiers to that area, basically, right?
Correct.
And for instance, I think you mentioned that, you know, there's all this, like from liver disease to kidney to cardiovascular to diabetes to low birth rate. And of course, all this must mean a lowered immune system, right?
Sure.
So could it be because, you know, here's the body fighting a fight on the mouth, and we all, no matter what, we have X amount of strength, mentally, physically, and so does the body. We have whatever immune system we have. And
sure.
we use half of it to fight this, or whatever percentage, it's not important now to get that right. We have less for all the other things, the little colds, the little sneezing, and the sniffles, and for the liver. So we have less soldiers to fight it other ways. That kind of like more or less how it, you know, in a very, very oversimplified way could be explained.
Well, absolutely. You know, anytime you have any sort of a bacterial infection at any stage or anywhere in the body, it takes a toll on your overall health. You know, your body is now overworking, trying to rectify what is causing this reaction. A quick example is a lot of patients, they have a TB test taken. And we've had this in schools. A lot of patients do have it for certain work-related, and it's basically just a quick, you know, you're introducing a little bacteria in the spot, and within 24 hours, if you see a nice round reddish spot in the area, you've, you know, your body has reacted well to it. And henceforth you don't have certain ailments. But no, you are absolutely right. It does take an overall toll on the body. The human mouth has a tremendous amount of bacteria, and with all the blood supply trying to fight that excessive bacteria, bacteria does get introduced into your bloodstream. And that's where the travel of this bacteria in your bloodstream has been found very strongly nowadays to all the systemic conditions that we have discussed a few moments ago.
Right. And on top of it, correct me again if I'm wrong, I know from many little things, such for instance, if a person faints, or if you take salt or potassium, you take certain things right on the tongue and under the gum, B12 or so that it goes into the bloodstream very fast, because around the gums, there's the most open blood vessel. I mean, that's why they're so red, right? It's almost open. It's almost a wound in itself. So if you have an infection there, wouldn't it be like, you know, you have this yellow, ugly, reddish pus. It's sitting right here. It has what? 1 foot to go to the brain to have a stroke, and 1 foot to go to the heart. And of course, it goes in the blood very fast. So now it goes all over the place. It goes down to the liver, and there it is. So it's actually one of the worst places to be infected. Yes or no? What do you think?
No, yes, you're absolutely correct. The human gum that we have in our mouth is very, very permeable, meaning that things have the ability to pass through it and get absorbed into the body a lot quicker. And as you had mentioned, there are many medications that we, in fact, here in the practice administer to patients, and patients, you know, take it as per the doctor's instructions as well, where you go ahead and place it right below your tongue, and it gets absorbed very, very quickly. Now, once absorbed in the bloodstream, you know, the whole body is open to this bacteria traveling to, like you said, from the head all the way down to your toe, and affecting potentially everything in between.
Right. And it must be important because, for instance, if any surgeon has a major operation anything more than appendix, maybe even for appendix, I don't know. But anyway, if he does a major operation, in most cases, the patient needs a bill of health, a clean bill of health from the dentist. And we're not talking about a tooth missing. He doesn't care about that. He cares about gum disease. Am I correct there?
You're absolutely correct. Medical clearances are needed for most orthodontic procedures, for most cardiovascular procedures, and for major surgeries as well. That being said, this medical clearance from a dental perspective is very important because what we're trying to eliminate is any active infections. Active infections would be gum diseases, a number one active state of infection in the human mouth. Any sort of active carious lesions or cavities that a patient may have, broken teeth, other infections which may need root canal. So any sort of active infection, including periodontal conditions, is something that has to be eliminated before any of these surgical procedures.
Because those conditions, this periodontal condition, any infection, wouldn't matter where it is, but it's very often here and unnoticed. That's why the doctor sent there. I mean, you can see if a guy has an infection in a toe and it's all swollen up, it's easy to see, but he needs to, it's because if there's an infection, the body is weakened. So in a major surgery cannot have a weak body. So it should tell us people, I think, look, I want to keep my body strong. I want to have my immune system ready for all the other things, not in something I could actually prevent with good flossing and a little bit of periodontal cleaning. Thank you very much, Dr. Patel. Very informative. Very, very informative.
All right. Thank you.